Hello, my name is Elois, and I'm going to be giving a presentation on the demonstration of insulin administration via the Novolog Flex Pen. The audience is going to be graduate students, nurse internship students, staff, physicians, and nurses of a level 1 hospital facility. The Novolog Flex Pen is a new innovation in the administration of insulin. The Novolog Flex Pen comes in 3 different varieties of insulin to be dispensed, but today I'll be talking only about the regular insulin of the Novolog Flex Pen. When you open it up, you will see a syringe, and the syringe has a medication port. The medication port is clear because this is regular insulin, and it has a dial, and the dial tells you exactly how much units you're going to be dispensing, and it goes from 0 to 60. So you can start at 0, and if this is your first time dispensing insulin from this pen, you dial it up to 2. There's a 2 right there in that window. So once you dial it to 2, you take the administration cap, the plunger, and you dispense it. And a bubble will come to the end of the needle. Once you dispense it, that clears all the air, and it means that it is ready for use. Once you get all that ready for use, you're going to make certain as a student or healthcare provider that you want to go by your 5 medication administration right. You want the right patient, the right drug, the right dose, the right route, and the right time. So, if it's time for your insulin, the first thing you want to do is wash your hands. After you wash your hands and you get ready to dispense your insulin, you want to make certain that you need to know how much you want to do. As I say, it goes in increments of 1 unit. I'm going to be administering 4 units, so I'll dial the dial up to 4 by turning the little black dial up. So I dial to 4, and once I dial to 4, then I'm going to double check and make certain that it is a 4. I'm going to find my insulin administration site and say a subcutaneous tissue. I take an alcohol pad, wipe it, take my little plunger, and give myself the insulin. Once you push the orange button, automatically 4 units will come out and it retracts back to 0. That means that it's ready for the next injection and the next in use. And you make certain that you twist off the needle and discard it. The needles are not reusable. Put your cap back on. So I'll go through it again slowly so you can understand. You dial up the amount of insulin and it starts at 0. I'm going to be dispensing 4 units. I want 4 units to be administered. So I take my alcohol pad, wipe my site, dispense 4 units by pushing the orange little plunger, and after I do that, I'm going to unscrew the needle, dispose of it, close my insulin, and this automatically retracts back to 0 and is ready for the next administration. Now, what I need is a volunteer for a return demonstration of the use of the insulin pen. Who would like to volunteer? Alright, you would like to volunteer?
Yes.
Okay.
So first I'm going to wash my hands. I'm going to dial my insulin to 3. I'm going to double check and make sure it's at 3. I'm going to take my alcohol pad and wipe on my injection site. Then I'm going to press the injection button on the end and inject. After that, I'm going to dial back to 0. Then I'm going to twist off the needle and replace the cap. So that's it's ready for the next person, my next injection.
That's very good. Are there any questions or concerns?
Yes. Does the insulin pen need to be refrigerated?
Once the insulin pen is open and ready for use, it is good for the next 28 days. So no, it does not have to be refrigerated.
Okay, thank you.
It's a mobile pen. You can carry it into your pocket or purse, and you can use it for 28 days without refrigeration. Any more questions?
Yes, is the insulin pen expensive?
The insulin pen runs you about the same amount of money that your regular old insulin setup when you had the vial and the old insulin syringes. So to answer your question in that respect, no, it is not expensive. It runs about the same. It's just a new innovation, making it more convenient for use. Are there any more questions?
Yes. Is a prescription needed for the needles?
In some territories and states, a prescription is needed for the needle, and you'll get the prescription when you get the prescription for your insulin pen. In others, there is no prescriptions that is needed. And you will dispose of these needles that you're talking about the same way that we did the traditional needles, in your little red biohazard little box. The outcome of this Insulin Flex Pen is for the students to acquire knowledge in the safe administration of insulin administrations to patients in our facility. I have here handouts that I'm going to be distributing to the audience, and they are consisting of t-shirts, mugs, and CD discs. So you can help yourself to the t-shirts, mugs, and the CD discs. And I would also like to thank you all for coming to my demonstration on the Insulin Flex Pen administration. And should you have any questions or concerns, you can refer to your CD disc, or you can also use these CD discs to educate your patients, educate your peers, your colleagues. I'd like to thank you all for attending my in-service. That's it. Did you go back? 'Cause